Hi all, welcome to Physio Exam Buddy. This video is on the special features of coronary circulation, one of the most commonly asked question in university exams. First of all, we will see about the arterial supply of the heart. The coronary circulation is the one which supplies the heart muscles. And out of this, there are two vessels, that is right coronary artery as well as the left coronary artery. Right coronary artery mainly supplies the right ventricle as well as the posterior part of the left ventricle. Whereas this left coronary artery, via dividing into an anterior descending branch as well as a left circumflex branch, it supplies the most of the anterior as well as lateral portion of the left lateral portion of the left ventricle. Next is about the venous drainage. The venous drainage to the heart is mainly by two networks, that is subpericardial network as well as by the deep cardiac veins. And under the subpericardial network comes the left coronary sinus as well as the right anterior cardiac veins which drain into the right atrium. Whereas the deep cardiac veins, it includes the arteriosinusoidal vessels which will connect the arterioles with the chambers, and there is a Thebesian veins which connect the capillaries to the chambers, and arterioluminal vessels also included in this deep cardiac veins, in which the small arteries drains directly into the chambers. A few words about the innervation of the coronary blood vessels, mainly by sympathetic as well as parasympathetic innervation is going to the coronary blood vessels. Now about the topic in proper, that is special features of coronary circulation. There is a difference in the flow of blood through the right coronary artery as well as through the left coronary artery in different individuals. That is, in 50% of the individuals, the right coronary artery has a greater flow when compared to that of the left. Whereas in 20% of the individuals, the left coronary has a greater flow, and the flow is equal in both right as well as left coronary artery in almost 30% of the individuals in whole population. And the coronary blood flow, it constitutes around 84 ml per 100 gram per minute or 250 ml per minute, that is approximately 5% of the total cardiac output. Again, there is a regional variations in the blood supply in the heart. Next special feature of the coronary blood flow is the phasic flow. That is, the flow varies during different phases of the cardiac cycle. During systole, there occurs a strong compression of the intramuscular blood vessels. So, there will be a decrease in the blood flow through these coronary blood vessels during the systolic phase of the cardiac cycle. Whereas during diastolic phase, our cardiac muscle relaxes. So there is no obstruction to the blood flow through the coronary blood vessels. So basically the coronary blood flow, it is more during the diastolic phase when compared to that of the systolic phase. Again, this difference is more in the left ventricle when compared to that of the right ventricle, because the force of contraction in the right ventricle is very less, and this maximal obstruction is seen in blood vessels which is lying in the subendocardial lanes. Next special feature of the coronary circulation is that this coronary blood supply, they got a maximum resting oxygen extraction, that is almost to 70 to 80% of the oxygen extraction happens in this coronary circulation, that is in and around 9.7 ml per 100 gram per minute, and the increased oxygen demand in a body can only be met by this increased blood flow. Another special feature is the higher capillary density which is found in the this coronary circulation, and the coronary blood supplied is mainly by the end arteries. That is, there is no anastomosis. But the problem is that if there occurs any blockage in this coronary blood circulation, it can result in the ischemia or infarction of the heart. Next special feature is that the blood flow is adjusted according to the metabolic needs of the myocardium. And the myocardium is the only tissue that generates its own perfusion pressure. And the last special feature and the most important special feature of the coronary circulation is that they exhibit the auto-regulation. Now, what is this auto-regulation is that there is a capacity of the myocardial tissue to regulate their own blood flow. That is, even if the mean arterial pressure varies between 60 to 150 millimeters of mercury, this most of the vascular beds, they have an intrinsic capacity to compensate for the moderate changes in the perfusion pressure by changing the vascular resistance. So, this capacity of the myocardial tissue to regulate this coronary blood flow, it is known as the auto-regulation, and it happens between 60 to 150 millimeters of mean arterial pressure. And this auto-regulation can be basically explained by two theories, that is myogenic theory as well as metabolic theory. And what is this myogenic theory is that there is an intrinsic contractile response of the smooth muscles to stretch. We all know that the blood vessels, it is made up of smooth muscles. Whenever there is an increase in the pressure, there occurs distension of the blood vessels. So the vascular smooth muscles surrounding the vessels will contract and it will decrease the blood flow back towards the normal. And this is one theory which explains the auto-regulation of the coronary blood flow. And the coronary muscles responds to the tension in the vessel wall. And in case of low pressures, there will be decrease in the degree of stretch of the blood vessel, and the smooth muscle relaxes, which will decrease the vascular resistance and return the blood flow back towards normal. And this myogenic theory is basically explained by the law of Laplace, that is, greater the degree of contraction at high pressures. You all know the law of Laplace, that is, the wall tension, it is directly proportional to the distending pressure times the radius of the vessel, that is T proportional to P multiplied by R. And maintenance of a given wall tension as the pressure rises will require a decrease in the radius of the blood vessel. Next is about the metabolic theory. That is, there is a tendency for a vasodilator substances to accumulate in the active tissues. Whenever there is a decrease in the blood flow, there occurs accumulation of the vasodilators, and these vasodilators will cause dilatation of the blood vessels. And whenever the blood flow increases, the opposite happens. That is, there will be wash away of these vasodilators. So there will be decrease in the dilatation of the blood vessels. And this is another theory which explains the auto-regulation of the blood flow. And to end, these are some of the vasodilator metabolites, that is decreased oxygen tension and pH, then increased carbon dioxide tension and osmolarity, increase in temperature, increase in potassium, especially in skeletal muscles, then lactate, histamine, as well as adenosine in case of cardiac muscle. These are some of the vasodilator metabolites which causes this metabolic theory. And you should end the answer with certain applied physiology. That is, you can write some words about angina pectoris or myocardial infarction or angioplasty or coronary artery bypass graft. That's about the special features of coronary circulation. Thank you.